The Joy of Giving Week, or DaanUtsav, was launched in 2009 to bring about a giving revolution in India, a public festival of giving. It is held from October 2nd to 8th every year across India, across over 1,000 corporates, several thousand schools and colleges. Hundreds of NGOs like Kunj, Give India, United Way and others participate in this festival in support of the Joy of Giving festival. CNBC TV 18 will, through the day, talk to NGOs and corporate donors to bring to you the stories of great causes and collaborative philanthropy. Joining us now is Dr Nandkumar Menon, founder of Ashwini. Ashwini provides comprehensive healthcare for one of the most neglected sections of our societies, the Adivasis of the Nilgiri Mountains. It is run by a doctor couple who returned from US to give back to society. They trained the local Adivasi girls as nurses. Training had to start from basic elementary maths and English. The idea has always been to empower the community, and today these Adivasi nurses have come a long way. They have become experts in conducting deliveries, in assisting the doctors in surgeries, in the general administration of the hospital, in ordering and managing the drug stocks, in designing systems to monitor the performance of the hospital. Also joining us live from our Mumbai studio is Paul, the Senior Development Officer of Health of Sir Ratan Tata Trust. Dr. Menon, I'll just go to you first before going to Anika. Tell me about the NGO, tell me about Ashwini, the scope, the reach and the kind of activities that you have been undertaking over the last couple of years.
Well, Ashwini was started in 1990 and our basic focus has been on helping the tribals stand on their own feet and using the tribals themselves as a deliverer of healthcare. So right from the start, we've been focusing on training tribals as healthcare deliverers. So we started off with village health workers, and then when the hospital came up, they were trained as nurses. So we take care of about 20 to 25,000 tribals in that area. And their situation is quite desperate in the 90s, with the population actually decreasing in number. So we set up a training program for the nurses, and the tribals themselves are delivering the healthcare. We now have progressed on from those days when we started in a small rented building to a good-sized 60-bed hospital, thanks to Tata Trust. And we have most of the infrastructure necessary now. So we have a base hospital, just 60 beds, providing secondary care, level care. And we have 8 area centers because our tribal villages are distributed in a huge area. We have more than 300 hamlets that we are covering. And so basically we provide both primary as well as secondary care. And for the cases that we can't handle, we refer them to the nearest medical college.
Okay, so let's talk about the trust then. Anika, tell us, you've been working with Dr. Menon since 2002. You have invested them in 4 tranches. So far, how much investment has gone in or how much donation has gone in? And tell us, why did you pick Ashwini?
The trusts have been increasingly investing in Ashwini based since 2002, like you mentioned, over 4 projects. The quantum of funds has increased from what was 2.5 million to about 7.2 million in the recent most grant. So it has been basically because Ashwini and its associate organizations in the region are working on issues that are very close to the Trust's own mandate of working with the underprivileged and supporting persons in rural and tribal contexts.
Anika, the Trust has worked across various initiatives. So tell us, how does Ashwini fit into the overall CSR strategy? And just give us a touch upon the kind of initiatives that you look at largely.
The trusts have basically 5 focus areas, which include livelihood, education, health, arts, crafts and culture, and building civil society and governance. Ashwini and its associate organizations also work on the same issues of keeping the Adivasi culture alive. Ashwini per se working on the health aspect, and other associated organizations on the same Adivasi groups' livelihood and education needs. So the trusts have been investing in the region of the Gudlur and Pandalur taluks systematically over time. So the trusts do fund the education and some amount of the startup for the livelihood component as well in the past.
Okay. Dr. Menon, coming to you, you were talking about how you have grown over the last couple of years, last multiple years in fact. Tell us, what were the challenges that you faced while you were expanding and looking at garnering funds and donations? Are funding opportunities and donation opportunities difficult in this day and age?
Well, actually, once the Tata Trust stepped in, we were actually quite well, I could say, well established with the infrastructure. So the reason for the expansion was that the tribals themselves felt that they should open their doors, because they're a small group, it's only about 25,000. But the area is basically a poor area with a lot of coolie labor and a lot of poor people. So they felt that they should expand the scope of the hospital and the health work to include them also, which is the reason why this expansion took place. And Tata Trust was wholly supported this. There's more than about 200,000 non-tribals who have been moved basically from Sri Lanka, who are also quite badly off. So it's actually the tribals who initiated this and said that they would like to open their doors, and that was the step towards building up the hospital to its present level, so it's to serve the tribals as well as the other poor people in the area. So funding has come. Fortunately, whenever we wanted funding, it has arrived, and we hope it will continue in future as the work expands to take this forward for this area that's quite badly, very poorly served, a remote part of the Nilgiris.
All right, Dr. Menon and Anika, thank you so much for joining us. Unfortunately, we are completely out of time, but congratulations, and it has been a very, very interesting journey for you, Dr. Menon, and Anika, of course, thank you so much for joining us.